What is the mechanism of manifestation of Pitta dominant disease? What is the pathological basis of Pitta dominant disease? This is the topic of discussion of this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. Pitta is an important bioenergy present in the human body as per the Ayurveda fundamentals. Whenever we speak about Pitta dominant diseases, several criteria are being mentioned which may be essential to predict the possible pathological processes happening inside the human body. In terms of the Pancha Mahabhuta, in terms of the rasa dominant substances intake, in terms of the guna dominant etiological factor, in terms of the vipaka virya dominant etiological factors, based on the prakopa karma observed in the patients, based on the lakshana analysis, based on the sthana or location of the pitta dosha analysis, based on the bhavasthana, based on samprapti, and based on the analysis of Nidana. So these are the different criteria which may be helpful in predicting the pathological events in the human body in case of the Pitta dosha vitiation. We are going to, in a little bit detailed manner, in the coming slides as such. Whenever if you think about the Pancha Mahabhuta point of view, basically the exposure related to the Tejo Mahabhuta substances. Katvam loshtupidahi tishna lavana krodho pavasa tapastri samparkatilatasi dadisura shuktara naladibhi. These are the different etiological factors where we are going to see the abnormal increase of Tejo Mahabhuta. Thereby, there may be a possibility of Pitta dosha diseases manifestation in an individual. When you think about the Shadrasa point of view, basically the Amla, Lavana and Katurasa substances, they are responsible for the abnormal increase of Pitta dosha in the body. Whenever if you think about the Amla, Lavana and Katurasa substances, one of the Mahabhuta dominance observed will be Tejo Mahabhuta. Whenever there is the substances intake which are having this particular rasa substances, Amla, Lavana and Katurasa, there may be the possibility of the initiation of manifestation of Pitta dominant disease. As far as guna point of view, Snigdho, that is Pittam Sasnehati Shnosh Lakhu Visram Saram Dravam. So these are the different qualities are being mentioned. Snigdha, that is unctuousness. Tekshna, that is the sharpness. Ushna, heat. Laghu, lightness. Visra, foul smell. Sara, unstable. And Drava, liquidity. Whenever a person is going to consume the substances having these qualities, there will be the initiation of Pitta dominant disease. Let us take another example. The person is doing the cycling in summer season. Naturally, so that will be responsible for the abnormal increase of Ushna and Tikshna guna and Laghu guna in the body. Thereby, if the person is doing the continuous cycling, that too in the summer season, there may be the possibility of abnormal increase of these guna. Thereby, the person may develop the Pitta dominant disease. Whenever a person is going to consume the Amla Rasa or Amla Vipaka substances, then there will be abnormal increase of Pitta dosha in the body. Virya point of view. If the person is going to consume the Ushna Virya substances, there will be abnormal increase of Pitta dosha. As far as the Prakopa karma is concerned, when you think about this particular joint, there are the two joints are being shown, whereas the right joint showing the abnormal redness, that is considered to be Raga. Whenever if you think about the left knee joint, that particular redness is absent. So that means there will be the abnormal increase of Pitta dosha in the right knee joint. The textbook says, Pittasya daha ragoshma pakitaha, swedah kledah srutih kotha sadanam murchanam madaha, katukamla varso varnah panduraruna varjitah. Whenever if you are observing any of these prakopa karma, we may suspect there may be a possibility of abnormal vitiation Pitta dosha in the body. As far as the clinical features are concerned, it is being mentioned, Pita Vinmutra Netratva Kshudra Dahal Panidratah Pittam. So that is the Pita Netrata, the yellowish discoloration of the eyes, conjunctiva, that too the bulbar conjunctiva. So that is indicative of normal increase of Pitta dosha in the body. As far as the sthana point of view, locations of the Pitta dosha are concerned. Nabhirama Shivasvedo Lesika Rudiram Rasa Drik Sparshanam Chapittasya Nabhirtra Visheshatah. So that means the enquiries should be done in relation to the dysfunction of these different organs. Any dysfunction related to Nabhi, any disturbed functioning, symptoms related to Amashaya dysfunction, Sweda dysfunction, Lasikara dysfunction, Rudhira dysfunction, Rasa dysfunction. So like that, each and every the sthana of the Pitta dosha has to be analyzed based on the sthana point of view. As far as Udbhava sthana is concerned, it is being mentioned that Adhova Amashaya is considered to be the natural location of the Pitta dosha. Hence, any kind of the dysfunction related to Pitta dosha dominance, the initial the disturbances are seen in Adhova Amashaya. Thereby that will be moving into the intravascular compartment, then that will be moving into the interstitial compartment, and later that may enter into the intracellular compartment, depending upon the nature of the exposure to the pathogens. As far as Bala Samprapti point of view, whenever a person is going to do the exercise, specifically during the summer season, so they are going to have the Pitta dosha dominance, depending upon the duration of the exposure to these particular geological factors, depending upon the degree of the Nidana Sevana, etc. So here, the person is exposed to this particular type of the summer as such, that is exercise, and he is doing up to 5 minutes, there will be mild increase of the Pitta dosha may take place. Whereas if the person is doing the exercise in the summer season, if it is up to 30 minutes, there will be moderate increase of the Pitta dosha. If the exposure of the Pitta, this exercise is happening up to 120 minutes as such, there will be severe form of the abnormal Pitta vitiation that can be seen. This is about the Bala Samprapti point of view. We can able to predict the possible Pitta dosha vitiation. As far as the Lakshana point of view, mild yellowishness, if it is of lemon yellow tinge, that may be considered as mild increase of the Pitta dosha. If the person is having the moderate yellowishness, that will be indicative of moderate increase of Pitta dosha. If the person is having the dark yellowish discoloration of the sclera, that is specifically seen in this particular image, that is indicative of severe increase of the abnormal increase of the Pitta dosha in the body. As far as Upashaya are concerned, if the person is going to consume the substances which are having the either Madhura Rasa or Guru Snigdha Guna or the Madhura Vipaka, etc., that may be responsible for the abnormal decrease of the Pitta dosha in the body. Whereas the consumption of the Katu Amla Lavana substances that may abnormally increase the Pitta dosha in the body. As far as Nidana point of view, so source of the entry of the pathogen into the body, that plays a major role in determining the Pitta dosha vitiation in the body, number of the pathogens entering into the human body, and the virulence of the pathogens entering into the human body, all they are going to decide the abnormal Pitta dosha increase in the body. For example, if the person is going to consume the chili, red chili via mouth, so that will be responsible for the abnormal increase of the pitta dosha in the alimentary canal. If the person is having the exposure to this red chili powder, that too via nostrils, they are going to have the abnormal increase of pitta dosha that may take place in nostrils as such. In that way, so this Nidana, they are helping in making the clinical diagnosis. When you think about the another example, what we can say, that is the cycling in summer, wherein that is responsible for the abnormal increase of the pitta dosha depending upon the nature of the exposure of these particular etiological factors in terms of the natural orifices. For example, if the person is doing cycling, that in the summer season, they will be having the breathing through the open mouth, depending upon the air hunger. In that particular situation, we may suspect abnormal vitiation of pitta dosha that may take place in the alimentary canal. Number of the pathogens entering into the human body. Whenever a person is doing the excess amount of the exercise, and if it starts to inhale or respire via open mouth, so that will be responsible for the increased number of the pathogens entering into the alimentary canal. In this way, so that will be helpful in determining the pitta dosha dominance in the diseased individual. Let us take another example of what we can say the cycling in summer season. All that is responsible for the pitta dosha vitiation depending upon the variability on the exposure of the Ushna Sevana into the nostrils. That is again, that may depend upon the variability to the exposure to Ushna Vata in different orifices and variability on variation in the Ushna Vata on the diurnal basis. That's also decide the Pitta dosha dominant disease in an individual. To summarize, the Pitta dominant disease, several factors are helpful in analyzing the pathogenesis in case of the Pitta dosha dominant diseases. Among them, the Tejo Mahabhuta dominant substances. They are responsible for the abnormal increase of the Pitta dosha. Katu, Amla and Lavana rasa substances intake. Amla Vipaka substances intake. As far as the Nidana are concerned, Snigdha, Tishna, Ushna, etc. Guna, they are responsible for the abnormal increase of the Pitta dosha. As far as Kupita karma are concerned, Pittasya dahara gushmapakitaha svedaha kledaha sutihi kota sadanam murchanam madaha katukam lauraso varnah panduraruna varjitaha. If the wise clinician observing these lakshana, then we may suspect the pitta dosha vitiation that is going to happen, that is already happening in the patient as such. Observing the amashaya as udbhavasthana are seen. Adho amashaya, that is considered to be the natural location of the pitta dosha chaya is going to take place. Observing the locations of the pitta dosha dysfunction. Nabhiramashayasvi tulasika hridayam rasa driksparshanam cha pittasya nabhiratra visheshatah. The wise clinician should inquire about the status of health of all these organs to predict the pitta dosha vitiation in the body by doing the careful analysis of samprapti of pitta dosha. So that is the Ushna, Tishna, that is the Vyavahi, etc. They are considered to be the essential for the manifestation of pitta dosha dysfunction in the body. Plus the careful analysis of the Nidana of pitta dosha dysfunction. For example, Katvam Loshmidahiti Labana Krotho Pawasa Tapastri Samparka Dilat C. These Surashaktarana Divi. These are responsible for, these are helpful in predicting the pathological events happening in pitta dominant diseases. That's all for today. What are the major key takeaways of today's discussion? Mention in the comment box below. What is the one video that active in the comment is in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Something more in the next video. Thank you.